Okay, for chapter 11, we will be discussing about the meeting needs related to death and dying. So first one, we will be discussing about the concept of loss. For the concept of loss, okay, we have a nursing goals. This is to promote good, pleasant dying through compassionate and palliative care. Okay, when we talk about palliative care, this is a specialized medical care for people living with a serious illness. Okay, another one is to facilitate coping with the disability and the death. Okay, when we talk about loss, it is a change in a person's situation that reduces the probability of achieving the goals. And also, it is when a person is without something he formerly possessed. So, the loss is not about yung, about sa pagkamatay, okay? Pwede ding loss yung mga things na which is very important to you. Okay, it is also an actual or potential situation in which a valued object, person, or the like is inaccessible or changed so that it is no longer perceived as valuable. And also, it occurs when a valued person, object, or situation is changed or made inaccessible and also diminished or removed sa life mo. And it's also an inevitable and inescapable. Okay, there is no one is exemption for this one. And for the categories of loss, first one is the self loss. Okay, under this one, we have the loss of psychological self. For this one, it includes the loss of self-esteem, okay, and also yung mga personal identity. Another one is the loss of socio-cultural self, and for this one, it includes the loss of the language, okay, another one, association, and the meaning of one's cultural heritage, and the influence of other cultures. Okay, another part of the self-loss is the loss of physical self. It is the extent, duration, and viability of the loss will influence how the individual respond to the loss. And also, yung loss of a limb or a part of the body. So, part siya ng self-loss under the loss of the physical self. Okay, another one is the loss of spiritual self. Okay, it is the loss of hope, okay, about spirituality, values, belief, ano pa, yung without hope, okay, despair sets in and the patients give up. So, napakalaking tulong ang about sa mga spirituality because that is one also ang ng ating mga coping mechanisms. Okay, pag wala to, malaki ang kulang sa'yo. Lalong-lalo na kapag kailangan na kailangan mo ng coping mechanisms. Okay, another one is aside from self-loss, we have the external loss. Okay, we have the actual loss. The external loss pala, it includes the loss of object, possessions, loved ones, and loss can occur through separation, okay, moving, promotion, or the death. Okay, for the actual loss, it can be recognized by others and the person sustaining the loss. Example is loss of a limb, okay, part of the body, spouse, for example, namatay asawa or divorce, like separation. Okay, valued objects like money or job. So, part siya ng actual loss. Another one is the perceived loss. Pag sinabi natin perceived loss, this is not necessarily seen or felt by others. Okay, this is only felt by the person but intangible to others. Okay, example for this one is the loss of youth. Okay, loss of youth, pag sinabi natin loss of youth, this is the uncomfortable feeling of being left behind. Okay, yun na pag-iwanan. Okay, financial independence. Okay, another one is the valued environment. Okay, physical and psychological loss are directly related to actual or the perceived loss under the second category. Okay, next one is the maturation or maturational loss. Okay, it is experienced as a result of natural developmental process. Example here is the loss that the first child flees when the new sibling is born. Another one is loss that a stay-at-home parent feels when the child starts school. Okay, that is under ng maturational loss because of the growth development ng mga bata. Hindi naman forever na baby sila. Okay? Another one is the situational loss. This is experienced as a result of an unpredictable event. Situational loss or situational loss experienced as a result of an unpredictable event. Okay? This is an event that did not allow a plan to happen. Example, yung mga traumatic injury, mga accident, okay? Disease na nag-cause ng death, and then also death, and then natural disaster. Hindi mo naman ina-expect to, hindi mo naman plinano, but it is unpredictable or hindi natin inaasahan. So, under siya ng situational loss. Pag may mga nawalang loved ones due to landslide, so under siya ng situational loss. Okay, for the anticipatory loss, this is a type of loss experienced before the loss really occurs. So, ongoing na ang ano nila feeling. For example, yung mga patient na may mga taning na ang buhay, ang mga family member nila. Okay? That is anticipatory loss kasi ina-expect na nilang mawawala. Okay, a person displays loss and grief behavior for a loss that has yet to take place. Okay, serves to lessen the impact of the actual loss. Okay, example, sabi nga, families of patient with serious and life-threatening illness. Yung nasabihan na ito na lang yung natitirang araw mo. So, expected na magkakaroon ng death. Okay? So, next one, we have tackled about the loss. So, next is the dying. Dying is an integral part of life. It is a natural and predictable as being born. Okay, pag sinabi kasi natin integral part, essential part na kasi to, di ba? Pag born or pagkabuhay, yung born, pag panganak, and then yung dying, part ng life yan. Okay? And then, universal and individual unique event of human experience. And also, it occurs suddenly as a result of an accident. It may be from injury, pathologic crisis, or due to the diseases, and after a prolonged experience of debilitating illness. Pag sinabi natin debilitating illness, it is either physical or mental health conditions that weaken our bodies and bring functioning over time. Okay? And also for the dying, it is the process of coming to an end. Okay? Coming to an end. Another one is the death. When we talk about death, this is the permanent, okay? Permanent cessation of all the vital functions. Pag sinabi natin cessation, nag-stop. Okay? This is the end of the human life. And then it is an event or the moment of death and a state of that of being death. Okay, dead. That is the death. Okay? Next one is we will be discussing also about the reactions to death and dying throughout the life cycle. So we will be discussing depende sa developmental stage. Okay? Iba-iba tayo ng mga coping reactions under the developmental stage. First one is the infancy to toddler. Pag sinabi infancy to toddler, this is 0 to 1 year old. Okay? Ang coping reaction ng mga to, no concept of death. Okay? Impossible to comprehend absence of life, egocentricity, all self-centered and selfish. Okay, di ba, hindi pa naman nila alam yan kasi mga baby pa lang. Vague separation of fact and fantasy. The dead is still exist. For example, grandpa is dead. He went to heaven. So, yun yung reason nila. There is no concept about death. For our nursing implications, we should avoid admonishing behaviors. For example, na admonishing yung scolding, okay? Sinisigawan, okay? Stress that person will only return in thought. So, hindi in person. For example, sa mga memories, doon lang natin sila naalala. Okay, and also consistent staff assignment. Dapat consistent tayo sa mga sinasabi natin sa kanila. Okay, another one is toddler, which is 1 to 3 years old. So for this one, coping reactions nila is crankiness. Okay, when we talk about crankiness, this is easily annoyed or upset. Another one is crying, through crying, and also through clinging. Okay, clingy sila. Okay, according to parents' emotional state, greatest threat is pairs. We have the acronym of pairs. For the pairs, we have the letter P. This is the painful, intrusive procedures. Okay. Another one is the altered rituals. Next, letter I is the immobilization. Another one is R, which is the regression. When we talk about the regression, it is a back or previous. Okay, pabalik, inaalala yung mga pabalik, o yung mga back memories. Okay, another one is S, which is the separation. So, yun yung mga greatest threats natin for toddlers. Another one is the it persists on visiting the dead. Okay, another one is anxiety, and they talk about the disease as if nothing happened. Okay, so we have the nursing implications here. Avoid admonishing behavior, same with the infancy and toddler. Okay, stress that person will only return in tough, same with the infancy to toddler. Okay, and also consistent staff assignment. So another one is the preschooler. We have the 3 to 6 years old. For this one, we have the uh, pre-operational thought. This is the meaning of preparational thought. Preparational thought, it focus on just one aspect of a situation or a problem. Okay, they use symbols to represent words, image, and ideas. That is the pre-operational thought. Another one sa ating preschooler, they have a magical thinking. Sasabihin nila, the dead lives underground. Okay? Consequences here is the guilt, shame, and punishment. For the psychosexual development has a heavy influence. Okay? Focus primarily in sex parent. And then God is viewed as a male human. Heaven, hell, and Holy Spirit considered frightening. Okay, natatakot pa sila dyan. Meaning of death, death is sleep and sleep is death. And recognize physical death as temporary and reversible. Okay, bumabalik daw. So, temporary lang, hindi siya yung permanent. Yung belief nila sa death. Okay, for their coping mechanisms, they have a giggling, yung through laughter, okay, joking, and then attracting attention. This is to make someone notice something. Okay, and also regression. Okay, the greatest fear for this age group, the preschooler, we have the 3 to 6 years old, parental separation. Okay, and then another one yung mga unusual activities nila. And then for the nursing implications, explain that the soul goes to heaven. Okay, the more outward the grief, okay, the less significant is the loss. For the ceremonies, tell child what to expect and then give choices. Another one is hold and reassure them. And then explain that death is final, hindi siya temporary or reversible. Okay, which is the death is no breathing, no eating, and no awakening. So that's it. That's the nursing implications under the preschooler. So next one, we have the schooler, which is the 6 to 12 years old. For this one, this is a concrete operations. Okay, thinks logically, deals best with actual objects and people, but can relate concepts and compare events. And also, it develops an awareness and understanding. They dream of other people's feeling and point of view. Okay, for their coping reactions here, we have the nightmares, rituals. This is a act of a signal to the self of one's control over a situation. They have a rituals. Okay. Next is daydreaming also. Okay, for their fears sa schooler, darkness and being alone. So ayaw nila yan. Okay, better understanding to casualty and prone to self-reference, privacy and understanding. That is also final. Okay, that is final for 5 to 9 years old. Best can be avoided. Possibly of life after death. Yung belief nila dito. Understands own mortality for 9 to 12 years old. Okay, that is reversible but beginning to see its finality. Personification of death. For the personification of death, they are endowing something that is not a person with human characteristic. Okay, also naturalistic and psychologic explanation. For the nursing implications, we have to allow to achieve independence, anticipatory explanations, and explain what is happening and what can be done. Okay, be realistic for mga schooler. Okay, next one is adolescent, which is 13 to 17 years old. We have the formal operations for this age. Okay, and then there is an abstract also here sa adolescents. Okay, abstract is from a Latin word meaning, okay, they pulled away or detach ang ano nila dito. Okay, that is a religious and philosophical terms. adult approach with remnants of the magical thinking, and also life is fragile but feels immortal. Another one is inevitable, universal, or permanent, and then they also reject deaths. Okay, for their coping reactions, for adolescents, we have maturation crisis. Body image is more important to them. Okay, alienates self from fears. Okay, so they withdraw or become isolated from their environment. Fears, lingering death, talks about loss, silent and withdrawn, undisturbed by events, and extremely angry, lack of fulfillment of adult roles, and idealistic view of the world is horrified and angry over the practical matters, fear of the unknown, and the funeral rites. Okay, so ito yung mga ano nila, coping reactions nila. And for the adolescent's response to grief, we have the dwarfs. For the dwarfs, we have the letter D, which is the despair, depression, and denial. And W is withdrawn. Okay, A is anger and aggression, R is repression, F is frustration, and S for silence. So, ito yung mga makikita nating response nila if there is a grief. Okay, other risky behaviors is independence versus the dependence, development versus the deterioration. So, ano mga gagawin natin? Nursing implications, we have to answer honestly and also be direct. Respect privacy, allow self-control and independence, structure hospital admission, acceptance and non-judgmental attitude, and also be a role model and allow ventilation of feelings for the adolescents natin. Okay, next one is the young adults. Okay, for their coping reactions, we have the rage, disappointment, and frustration. Sa rage, di ba yun yung very strong and uncontrolled anger. And then there's also an unwelcome intrusion. Okay, for their nurse implications, patient group support. Okay, next one is the middle adults, which is the 30 to 60 years old. Ang mga ano nila dito is unmet goals. Okay, threat to emotional integrity. Another one is concern nila is consequence of own death and that of others, and also pain. Okay, and then for late adults, which is 60 years old and above, for their coping reactions, philosophical rationalization, which is life is over and when time runs out, and it is a new life, and rest and peaceful reflection. And for their fear, yung prolonged illness, lalo na kapag meron silang mga chronic illnesses, freedom from pain, and also reunion. Okay? So, for their nurse implications, we have a religious belief for comfort, help prepare for their own death, reminiscing. Okay, ito yung mga enjoyable recollections of past events, care and comfort, and also be present at the death. Okay? So, yan yung mga different reactions to death and dying throughout the life cycle. So, next one is the summary of the coping behaviors. First one is the grieving child. Okay, for the preschooler, which is 2 to 5, we have the REST. Okay, acronym REST. Regression, express little concern, separation from the fear, and temporary state. For the early schooler naman, 6 to 9 years old, we have the uh, CABG, okay? Cry, anxious often, and better understanding of death. Okay, grass is unclear about the cause and effect. Okay, for the late schooler naman, which is 9 to 12 years old, they have the drugs, okay, distancing and daydreaming. They have the realistic view, afraid to leave home, grades are poor, and separation anxiety. And for the adolescent naman, we have the SAD, substance abuse, angry and aggression, and drastic behavior. Okay, for this drastic behavior, this is a acting rapidly and violently. Okay, next is the grieving adult naman, which is 18 to 35 years old. Okay, influenced by religious and cultural beliefs, example, yung mga priest and minister. For the 45 to 65 years old, it accepts own mortality. Okay, acceptance. They encounters death of parents. Okay, and also the experience death, which is naglilid to anxiety. Okay, for the grieving process naman, it is a process of psychological, social, and somatic reaction to a perceived loss. either emotional reactions to a loss. And for this one, this is the process of coming to terms with that loss. Pag sinabi natin grieving process. It is also said to be a natural reaction, often expected to any kind of illness. It is also the total response to the emotional experience of the loss and its manifested thoughts, feelings, and behaviors. And for this one, a normal subjective emotions responses to loss, okay, essential for good mental and physical health. And it is better termed as states. Okay, since grieving is a dynamic, when we talk about dynamic, it is a characteristic by constant change. So, nagbabago. Okay? For the grief naman, this is a mental suffering. Okay? Sharp sorrow, painful, subjective, and individualized. Okay? Follow loss and accompanies mourning. And also, dagdag lang din sa grief, this is a natural response sa loss. Okay? For the disenfranchised grief, it is briefly over a loss that is not or cannot be acknowledged openly, okay, mourned publicly or socially supported. So hindi siya ina-acknowledge publicly, okay? For this one pala, disenfranchised grief, it occurs when the grief you are feeling is not supported by society or recognized as legitimate. For example, death of the partner in an extramarital affair. For example, ikaw yung kabit, kaya namatay yung ano mo, for example, sugar daddy mo. So, wala kang karapatang mag-mourn in public, okay, na ikaw yung nawalan. Because hindi siya legal or hindi siya legitimate. Okay? And also, loss of a job also is part of disenfranchised grief and divorce. Okay? Yun yung mga examples natin ng disenfranchised grief. Okay? We have three categories of circumstances that can result in disenfranchised grief. Number one, a relationship has no legitimacy. Sabi nga kanina natin sa example. Loss of itself. The loss itself is not recognized. Okay, hindi siya na-recognize, lalo na sa public, hindi pwedeng i-acknowledge openly. The griever is not recognized. Okay, so tanggal natin yung E dito. The griever is not recognized. Okay, kung nagmo-mourn ka dyan, hindi nire-recognize. For the mourning naman, okay, mourning, this is a period of acceptance of loss, nagmo-mourn, okay, and grief during which the person learns to deal with the loss. It is also characterized by return to more normal living habits. Okay. For the bereavement, this is a period of sadness. It is the state of grieving during which a person goes through the grief reactions, a state of having suffered a loss. Okay. Bereaved people often neglect their health to an extreme because of their feeling of sadness. Next one is the general characteristics of grief stages. We have reactions to grief and dying are similar. Stages of reactions overlap and vary among individuals. And for the normal grief reactions, we have normal lang na maramdaman, okay, habang nag-grief, or yung natural response natin kapag may loss. We have the denial. Okay? Hindi mo naman agad-agad niya accept eh. Okay? So first one, hindi ka pa rin makaniwala. Yung isang reaction natin is denial. Okay? Hindi totoo yan, hindi totoo, hindi pa siya wala, mga ganon. Hindi naman agad-agad na wala na talaga siya. Okay? So denial first before you accept. Okay? Pinakalas ng acceptance. Kung totally na-accept mo na nawala na talaga. Okay? Next one is sadness. Okay? Isang part ng grief natin, di ba, pag nawalan, hindi ka naman masaya. Okay? Another one is anger. Magagalit ka. And then, there is also a feeling of fear and also anxiety. So, yun yung mga normal na grief reactions natin. Okay? Next one is symptoms of grief. For the symptoms of grief naman, we have the physically drained. Okay? Physically drained. Okay? Kasi naubos na yung lakas mo. For example, tagal mo na umiyak. Okay? Iyak ka na, pinagluluksa mo. Okay? For next one is the emotionally out of control. Okay? And also there is no appetite and prone to diseases. For example, hindi ka kumain, hindi ka natutulog, and then yun, nagkasakit ka pa. Okay? Bagsak ang immune system. Easy fatigability. neglect work, okay, hindi sila pumapasok, physical appearance, hindi na sila nag-aayos, and also personal hygiene. Nagkukulong na lang sila, nagmumukmok, so hindi na nila naaalagaan yung sarili nila. Okay, loudness, and also guilt. This is a person who is guilty cannot move on. Okay? Kapag hindi nila napatawad yung sarili nila. Lack of interest, ayaw nilang gawin, kung ano man yung mga pwede nilang gawin. Zombie effect, for this one, existing without life. Okay? Parang, paano pa ako nabubuhay, parang wala naman silbi. Ganun lang iniisip nila. And then, thinking is unclear, and they are very forgetful. Pag hindi naman talaga sapat yung nutrients na nare-receive mo, hindi tama yung enough time ng sleep mo, okay? Hindi rin tama yung the way ng ano mo, yung for thinking mo, okay? Makakalimutin ka na, mga ganun. Okay, another one is cry continuously and then sighing. Okay, nagsaside, okay? Emit long, deep, audible breath expressing sadness, okay? Buntong hininga, di ba? Malalim yung buntong hininga. Express sadness, relief, tiredness, and or a similar feeling. Another one is lack of interest in sex and alterations, and there is an alteration in the libido. Okay, so yan yung mga symptoms natin sa grief. For the factors that affect the grief and dying, we have 5. Okay, first one is the age. Okay, for the age naman, the younger the individual is, the lesser the easier the grief. Okay? Children do not understand death on the same levels as adults do. Okay? Kasi nga, di ba, iba-iba tayo ng reaction sa about death, lalong-lalo sa mga developmental stages. Hindi naman tayo same ng pag-iisip. Okay? Death of parent can retard a child's development, or there is a regression wherein they return to a former or less developmental state. Okay, next one is the nursing implications here is prepare oneself for inevitable death. Pag sinabi inevitable, hindi na siya may stop. Okay, family role. Next one is family role. Death of a child, okay, it is devastating to the family. Okay, kailangan namang uunahan ka pa ng anak mo kaysa sa'yo na matanda na. Okay, next one is the loss of spouse. Okay, ang ano mo dito is protect the child or the children. And loss of parent naman, yung mag-eldest sibling feels the need to be strong, okay, and therefore may not grieve openly. Sila yung mga may kinikim-kim. Kailangan ko makita nila ako mas malakas. Kasi nga ako na lang yung inaasahan nila sa family kasi wala na kaming parents. Ganun ang sasabihin nila. Okay? Nursing implications, give time to talk and be listened, to allow family to enough time to accept reality of the situation. Hindi naman madaling tanggapin agad, okay? So we should also give time. Allow family to express themselves in non-judgmental way. So makinig lang, okay? So next one is the socio-economic factors. We have the economic loss. Okay, bereaved families suffer more if there is no life insurance. Okay, so problema sila yan. Saan tayo kukuha ng financial pang support ng habang ongoing yung grief nila, okay? Loss of home, support system, especially if death of spouse may lead to down income, lalo na kapag ang namatay is yung breadwinner ng family nila. Okay, so next one is the cultural influences. Okay, it varies from culture to culture. Okay, person to person, we have an example. Male, okay, they are expected to be emotionally supportive. So according to culture, ito na yung masusunod. Female, they are expected to be weak and need support. Okay? In Western culture families, grief is a private matter. It is shared by the family only, but others may display emotions. Okay, next is the religious influences or the religion. Faith and religious practices play important role in expression of grief and provide comfort and solace to the person experiencing the loss. So, yan yung mga factors natin that affect the grief and dying. Yung 5 factors natin. Okay, grief and family. Next natin, grief and family. We have the denial, okay? Initially support and then strive to increase the development of awareness. And when we talk about denial, this is the refusal to accept the facts of the loss, okay, either consciously or unconsciously. Okay? Then hindi mo pa ina-accept yung loss, okay? Next one is isolation, okay? Listen and spend designated time consistently with the family personally. Another one, we should offer the person and the family opportunity to express their emotions. Another one is reflect on past losses and acknowledge loss behavior. And also, sa isolation natin, this is a grieving person intentionally stays away from others. Kinilalayo niya yung sarili niya because they need time about the sa grief. Okay? Next one is the depression. Okay, depression, it is begin with simple problem solving and move towards acceptance and enhance self-worth through positive reinforcement. Okay? And then identify the level of depression and indication of suicidal behaviors or ideas. So, assess natin yung level of depression niya kung gano'n nakalala. And then, kapag may mga indication or may pinapakita siyang mga signs na magko-commit siya ng suicide. Okay? Be consistent and establish regular time to speak with the person and family. Kasi di ba nga, mas magandang ino-open up nila yung nararamdaman kesa yung kinikim-kim nila. Okay? For the anger, it allow the crying to replace their energy, listen and communicate to them, and also encourage concern, support from significant others, as well as professional support. Okay, next one is the guilt. For the guilt naman, listen and communicate. Allow crying for the person, and then promote more direct expression of feelings, and then explore methods to resolve the grief. Kasi baka yung guilt niya na yan sa sarili niya, hindi niya ma-recover or hindi niya ma-overcome. Okay, it can cause a serious problem kapag hindi pa siya fully healed. Okay, next one is the fear. Help the person and family recognize the feelings. Explain that that this will help cope with life. Okay, explore that the person's and family's attitude about loss and also the death. Okay, next one is the rejection. It allows the verbal expressions of these feelings state to diminish the emotional strain and recognize that the expression of anger may create for rejection of self to significant others. Okay, so yan yung ating grief and the family. So next one, we have the different signs of impending death. Okay, we have 5 here. So clinical death, sa clinical death natin, okay, we have the function stop, okay, clinical. Yung mga functions is nag-i-stop. And then there is also an apnea, di ba, cessation of breathing, nag-stop. And patient will go into coma. Okay, kapag nag-stop kasi mga functions mo, lalo na yung mga sa brain natin, pag hindi na siya nag-work talaga, okay, it can lead to coma. Okay, comatose, wherein unconscious na sila. Okay, for the next one is the biological death. For the biological death, there's an organ, or the organ ceases to function. Okay, no pulse rate and then no respiratory rate. So, hindi na nag-work yung heart niya and then yung lungs niya. And then also, yung brain and heart stop. So, pag once na nag-stop yan, wala na talaga. Okay, that is the biological death. Okay, next is the cerebral death. Okay, for this one, it affects the cerebrum. Okay, pag sinabi natin cerebrum, this is a part of the brain that starts and manage the conscious thoughts, and this is the largest part of the brain, which is responsible for memory, speech, senses, and emotional responses. Okay, another one is irreversibly unconscious. Pag sinabi natin irreversibly, hindi na siya gumagaling or bumabalik. Okay, irreversible. Next one is brain death. For the brain death naman, cerebral panecrosis or the extensive tissue death. Okay, brain dead na siya. Social death naman, this is the time when the physician pronounces the death. Okay, kahit na nag-stop na yung pag-work ng heart niya, okay, pero yung inaantay nating time para malaman ng tao declared, yun yung declared na time ng death. Ang magde-declare dyan is the doctor, okay, or physician. Time of death, then sasabihin niya yung time. So, yun na din yung time na ilalagay nila sa chart. Yun na rin yung time na ilalagay nila sa mga death certificate. Okay? For the different clinical signs of death naman, we have the loss of muscle tone. For this one, there is an incontinence, di ba? Either bowel and also urinary incontinence. Hindi na nako-control. Another one is the dysphagia. This is the difficulty in swallowing. Okay? And then dysphagia. For the dysphagia naman, this is the impairment in the production of speech resulting from brain disease or there is a brain damage. Loss of gag reflex. Okay? Another one is decrease ang kanilang GI motility and inspired incontinence. And there is also a decrease in body movement. So that is the loss of muscle tone. Wala nang lakas. Okay? So next one is the decrease in circulation. For the decrease in circulation, we have the skin becomes cyanotic. Okay, magiging color kasi niyan, there is a bluish discoloration of the skin pag sinabi nating cyanotic. Kapag hindi na magandang circulation, nag-cyanotic na, so nagbe-bluish discoloration na. Okay, another one, so yung mga clinical sign ng death na nakikita. Okay, we have the cold and clammy feet. Okay, malamig. And yung aside sa feet, sa hands, ears, and sa nose. Okay, so nagde-decrease yung circulation, so nagbabago yung kulay and then the temperature. Changes in the vital signs. For this one, everything goes down. So, nagdi-decrease lahat. Puro mga nag-slow down. Breathing is shallow, irregular, abnormally slow. Does mouth breathing, causing dry mucous membrane and lips to crack. So, mouth breather na siya. Kasi nahihirapan ng huminga. Okay? Sa eyes naman, there is yung pupils, yung maliit na block sa mata natin na nag-react sa light. Okay? The pupils dilate. Okay? So, kaya, ibig sabihin nun is lumaki yung black. And then, dull's eye. Yun yung nakikita kapag there is a malapit na, okay, signs ng death. And then, there is also a swallowing and yawning until the last breath. So, yan yung mga changes natin. Another one is flat ang kanilang ECG. Saan bang ECG? This is flat ang kanilang electrocardiogram. Okay, kapag yun yung mga nilagay na electrodes, okay, para ma-check kung may rhythm pa ba yung heart. So, pag wala ng contractility ng heart, ibig sabihin, flat line na yan, makikita nila. Okay, so, next one. So, yun yung mga makikita nating clinical signs for death. Okay, next one is changes that occur while approaching the death and after death. We have the facial appearance, sight, speech, and hearing. The facial muscle relaxes. Okay, the cheek becomes flaccid. Becomes soft and yields passive stretching. Naglalaylay. Facial structure changes to distress and frowns. Another one is the pale ashy skin. Okay, sunken gazing eyes. Sight gradually fails. Eyes remain half open or gazing. We have to cover or wet the eyes with a plain NSS to prevent the drying. Okay? Pupils are fixed. Do not react to light. So, wala na silang reaction sa light kapag gagamit kayo ng pen light. Another one is speech become difficult, confused, and finally, impossible na magsalita pa sila. Okay? Hearing is retained, being the last sense to be lost. So, kapag pwede pa rin kausapin ng mga family member kasi nga isabihin natin na nakakarinig pa sila yan kasi yun yung last na sense na mawawala sa patient na namamatay or namatay. Okay? Next one is skin and musculoskeletal system. Okay? For this one, muscles relax, patient is increasingly losing capacity to move, and lips lose reflexes, sensation, ability to move following death, muscles become fixated. Okay? Pag sinabi natin fixated, stuck na. Okay? Rigor mortis, kapag sinabi natin rigor mortis, this is the stiffening of the body few hours following death. Starts from the jaw, okay, and then progressing down to the body. Pababa siya. Okay, immediately following that, movements of the body occurs. As death approaches, skin becomes pale. Okay, pale in color, parang wala nang dugo. Cool with excessive and profuse perspiration or diaphoresis, pinagpapawisan. Increase or uncontrolled temperature. The thermoregulating center fails. Following death, body cools rapidly initially, then gradually reaches an environment temperature. Okay, clinically death, pag sinabi natin clinically death, okay, the respiratory rate and heart rate stops. Biologically alive, okay, pwede pa naman silang ma-revive through the use of epinephrine and then yung mga CPR, cardiopulmonary resuscitation. Okay, Patient remains alive for a period of 3 to 4 minutes after the heart ceases to beat. Okay? One grace period passes, biologic death occurs, resuscitation is useless. Okay? Ang ibig sabihin kasi nun, brain is severely damaged. Okay? Kapag sinabi ng biological alive pa kasi, alive pa siya for a period of 3 to 4 minutes. Okay? After na nag-arrest yung patient natin. Masasabi nating nabuhay siya. Okay? And then, hindi na siya ulit nag-flatline. Pero kapag ka nag-arrest ulit, nag-flatline ulit, so that is only effect of the medication, which is the epinephrine. For ano kasi din yan, muscle contractility sa heart natin, sa heart. Okay? Next one is the respiratory system. For this one, breathing pattern will change and become irregular. We have that one is the term for this one is the kind strokes, okay, which is rapid and shallow or very slow. Okay? 10 to 30 seconds period of no breathing, we call it the apnea while asleep. And then sa ating CNS or the central nervous system, the patient will spend more and more time sleeping. Okay? And then at the times of difficult to arouse. So, tulog ng tulog hanggang sa mahirap na siyang gisingin. This results from the body's slowing metabolism. Reflexes are gradually lost, and there is a restlessness. Okay, for this one, owing to need of oxygen because the blood circulation is slowing. Kaya nagkakaroon ng altered in the sa brain natin. So, nagkakaroon ng restlessness. Okay, pagwawala. Okay, consciousness is lost and reflexes are absent. So, under yan ng ating changes sa central nervous system. Another one is the circulatory system. There is a change occurred due to alteration in temperature, RR, or the respiratory rate, pulse rate, as the circulatory system gradually fails. Okay, another one is rapid irregular pulse rate progresses to death. Okay, magtataki yan hanggang sa biglang mag-arrest. Okay, following death, uh, uh, following death natin is the postmortem hypostasis. Okay, pag postmortem after the death. Okay, there is a bruise-like reddish or bluish discoloration of the skin. Okay, although this is a problem under the circulation. So, next one na system na involve or madadamage is the gastrointestinal and the genitourinary system. We have the nausea and vomiting. Weight loss is common. Okay, impaction, fecal impaction to, hindi na makalabas. For example, parang constipated na, naipon na doon because of loss of the movement dun sa ating GI system. Okay, urine retention, hindi na makalabas. Distended na kasi hindi na siya mai-release ng body niya. Bladder and bowel incontinence may be present. So, this is the uncontrolled. Okay, decreasing peristalsis prevents stomach from emptying intestinal content. The stomach will distend kasi nga hindi na nila mailabas because of the decrease in peristaltic movement. Impaction occurs due to the lack of energy needed to evacuate the bowel. Wala na silang energy para mailabas yung kanilang feces. Okay? So, it can lead to fetal impaction. Nakabara na doon. Okay, incontinence is due to the relaxation of the anal and bladder sphincters. Dahil nagkaroon ng relaxation, hindi na nila nakokontrol yung kapag hindi nila, for example, pag naiihi ka, di ba, kaya mo i-control yung sa sphincter mo para i-hold mo pa habang papunta ka sa CR. Pero this one, there's a problem in the relaxation. Okay, so nagre-relax yun, kaya nagre-release lang yung either urine or ayun, sa urine natin, there's a urine incontinence. Another one, okay, we will be discussing also the dysfunctional grieving, abbreviated grief, anticipated grief, and unhealthy grief. For the dysfunctional grieving, okay, for this one, when the person cannot move on with the normal activities, does not allow a person to adjust a situation, state in which an individual or group experiences prolonged unresolved grief and engage in detrimental activities. When we talk about detrimental, gusto na nilang magkaroon ng mga activities na very harmful. Okay, wala na silang pakialam kung may mangyari sa kanilang masama or hindi. Okay, that is under the dysfunctional grieving. Next is the abbreviated grief. This is brief but genuinely felt. Okay, this is a short-time-lived response to a loss. Another one is anticipated grief. It is experienced in advance of the event. Okay, occurs before the actual loss. Yung sabi nga natin kanina, nag-grief ka na because you know already na there is yung time na natitira sa family member mo. Okay, another one is unhealthy grief. Okay, for the unhealthy grief, it is a pathologic dysfunctional grief. Okay, it is also a prolonged suffering sa ating unhealthy grief, interrupts the normal activities, and it prevents life from being lived to the fullest. So, hindi na siya healthy. Nagkakaroon na siya ng mga uh, karamdaman sa kanya because of yung grief na hindi tama, na the way yung pattern ng grieving niya. Okay? Next one is the nursing process in death and dying. Okay, for this one, assessment of the patient and family experiencing the loss or the dying and death. Okay, we have the O. Okay, we have the O2. We have the O2 phases of the living, dying, and related tasks. Okay, we have number one, the living with illness phase. Okay, for this one, at the time the illness was first diagnosed. So, ito na siya. Ito yung mga phases natin. And then, after that one, you know daw the illness after mong malaman. Okay, we have the active dying phase and also the time of death and the follow-up of bereavement phase. When we talk about the bereavement, di ba, ito yung the period of sadness. So, ito yung mga phases of living and dying ni O2. Okay? The living with illness phase, this is the key task of patient and family at their phase. Okay? The need to obtain and gain understanding and information regarding the illness. For this one, it includes the information about the medical nursing treatment and what to expect and what the patient and family need to do. Okay? So, the living with illness phase, di ba sabi natin kanina, ito yung the time that the illness was first diagnosed. So, i-inform naman kayo, i-brief kayo ng doctor or physician about the condition of the patient, ano yung mga kailangan yung gawin, ano yung mga support na kailangan natin gawin for that family member. Okay? The need for assistance and information about the limitation imposed by the illness and what resources are available to assist them. Another one is also a period of adjustment as family member develop the new roles. Okay? So, there is a changes in the family roles. And then the patient and family need to develop trusting relationship with their caregivers. Okay, lalo na pag sabi natin caregivers, sila yung mga tutulong para maalagaan or habang naka-confine ng patient, sila yung mga tutulong sa kanila for their daily livings kapag there is a limitations. Okay? And then also, the need for assistance in maintaining hope while dealing with the reality with the disease process and the implication of the threat to life. Okay, the families need to develop strategies to meet the needs of the ill person to retain as much control over his or her life as possible. Okay, another one, the patient and family need to discover coping patterns that will assist in limiting their awareness of the impact of losses and conserve energy so that the living can continue. Okay, lastly for this one, the need to maintain and or restore the relationship with significant others and the need to tie up loose ends kapag may mga hindi pa mga naayos sa family. Okay? So, under na siya dito sa ating the living with the illness phase. Another one, may ano pa tayo, we have 9 and 10. Okay? The time to some degree to recognize and resolve unfinished business. Okay, dito na napag-uusapan. And then, caregivers need to develop a system that permits them to care for themselves and continue living fully as possible. Okay? So, ito yung mga phases natin kay Otos. The next one is the active dying phase. Okay? Patient or family task under the active dying phase. Okay? Anong gagawin nila dyan? If the patient is cared for at home, okay? If the patient cared for at home, the caregivers will need instructions on the care of the terminally ill. Okay? May mga specific tayong instructions lalo na kapag may mga medications, may mga specific activities for the patient. The family caregiver needs to regulate the emotions to attend to personal needs, the dying person's needs, and the family system needs. Okay, next one is the patient and family will experience the pain of separation as the patient begins to withdraw. Okay, the need also to remain sufficiently engaged to provide care. comfort, and presence to the dying person and the other family member. The time of completion of significant issues or of the reconciliation and also forgiveness. Ano pa yung mga dito? As far as possible, the time to accept or recognize the earth life is ending. So, under dito sa phase ng active dying phase. And the need for some form of acknowledgement of the bonds of the dying person to those who remain and some formalization of the creation of memories. And the dying person needs for assurance that he or she will be remembered, lalo na sa family. Okay? So, dapat under dito sa active dying phase. Another one is yung mga task at the time of death naman. Okay, at the time of death, assess of the need and wish of the family to be present at the time of death. Okay, we should know, we should assess, we should ask. And the patient should not be left alone at the time of death. 'Di ba? Yan yung parang ano nila pag andiyan ang family, ready na nilang tanggapin yung end ng kanilang life. Basta andiyan yung support ng family. Kasi yung fear na magmatay kang mag-isa, 'di ba, iba pa rin kapag may mga support system pa rin na nakatabi sa'yo. Okay, lalo na kapag for example yung mga nag-anuhan namin dati sa ICU kapag malapit na kasing mamatay, as in yung whole family pumupunta talaga. So, we open the ICU for them, okay, para lang makausap niya lahat ng family members na gusto niyang makita before na mamatay ang patient. Okay? Another one is assessment of who the patient or family wanted to be present. So, depende kung sinong gusto niyang ma-meet, okay? Such as clergy, okay, kung gusto niyang magpamisa, okay, other family members or friends. Lalo na yung mga gusto niyang makita na malayo. For example, yung mga anak niya na nasa malayo. Gusto ko siyang makita before, kasi naantayin naman talaga. Minsan may mga inaantay talaga after na dumating is doon na sila. Kapag nakausap na nila, doon na sila namamatay. Okay? So, there is a feeling siguro na yun yung paninindigan nila na magtagal muna ako hanggang makausap or makita ko siya. Okay? And then, yun na yung nila na parang there's a self-fulfillment. Okay? The family need the information about what to expect at the time of death. Okay? The family needs for assistance if in notifying the appropriate person about the death, such as a funeral home, so we should assist them. The family needs for permission to remain alone with the patient's body after death. Okay? So, after ng death, for example, nag-CPR kayo, kung may mga family naman na do not resuscitate, so after na antayin na lang yung pag-stop ng heart ng patient, then pag-announce ng time of death ng mga physicians, okay, before naman natin ipa-handle, ipahawak or matignan ng mga family members, aayusin muna natin ang patient, but we call that one the postmortem care. Okay, lilinisan and then bibihisan natin ng maayos yung bangkay ng patient before natin i-open up sa family para pwede na nilang tignan, hawakan, ipag-pray over. Okay? And then, family task naman after the death. Okay? So, after the death na, if the patient died at home, the family needs assistance with the preparation of the body. They may need assistance in arranging the funerals, memorial rituals meaningful to them and the deceased. They may want the need encouragement to use this period to reminisce about the good days with the patient. Okay? So, ito yan yung mga ni O-tools natin. So, next one is the data analysis, which is the nursing diagnosis. Diagnostic title, we have the anxiety. Okay, for this one, ang mga possible etiologies nito, bakit nagkakaroon ng anxiety, okay, there is a financial insecurity, fear of own death, and loneliness, and also there is a threat to self-concept, change in health status, okay, yan yung mga under ng anxiety. Ano pa ba? Socioeconomic status, and the role functioning and threat to the death. So, next one is the role performance altered. Okay, possible mga causes nito is changes in social involvement, okay, due to the life-threatening illness. So, magbabago na yung role performance niya. Okay? Next is the hopelessness, okay, failing physical condition, and yung abandonment, okay, naiiwanan. Next one is the denial because of the threat to life. Okay, denial. Ayoko pa, hindi ako mamamatay. Okay, so yan yung mga possible cause kung bakit nagkakaroon ng denial. Hindi pa nila na-accept fully. Okay? Next one natin is the powerlessness. Okay, we have the etiologies here is the healthcare environment. Okay, and then illness-related regimen. So, dahil sa condition nila, okay, yun yung feeling nila, powerlessness. Grieving and anticipating. Okay, potential loss of significant person, object, and body part. Expected, anticipating. Okay, social interaction, which is impaired. Okay, there is a poor communication skills, self-concept disturbances, absence of significant others, and altered ang thought process. Okay, so next one is the social isolation. There is an alteration in physical appearance, okay, and the state of wellness or altered mental status due to the yung pada-generate na yung condition ng patient. Okay, another one is the grieving dysfunctional. Okay, there's an actual or perceived object loss and then the lack of family support. Okay, so there is a dysfunctional grieving. Next one is the need of the dying and their corresponding nursing interventions throughout the living dying continuum. We have the physical needs. First one, we have the mouth. Okay. So under this one, we have to remove the dentures because they obstruct breathing. Okay. Lagi yan, lalo na kapag ka nasa hospital ka talaga, we should, lagi nating ina-ask kung if there is a denture, yung mga postiso, kailangang ma-remove kasi baka magkaroon ng accident wherein matanggalan, for example, ma-intubate siya, kaya matanggalan ng isang ngipin, malunok pa. Okay, so we should, that one, assess. Okay, which is also contribute to nausea and vomiting, yung sa dentures. Okay, next one is to lubricate the patient's lip because yung mouth and lips natin nagbe-become dry. Okay, nagda-dry yan due to the elevated temperature. Okay, next one, sa eyes. Okay, when vision fails, communicate more with speech and touch. Okay, baka magkaroon pa ng accident. So, we should communicate more to patients natin. I-assess natin kung okay pa ba yung vision niya or kung hindi na. So, we should assess for the risk for injury or accident. Okay, so we communicate through the speech and touch. Okay, keep room comfortably illuminated, okay, well lighted. Prevent shining light to patient's eye because patient's eye are glazed and dry. If the eyes are open during the terminal stage, we should protect the eyes with a normal saline solution and eye pads para hindi siya mag-dry. Okay? So for the skin, for back rubs to promote circulation, 'di ba? Para nung nag-back massage, bakit tayo nagba-back massage para to promote a good circulation on that part. Okay, another one is frequently turning of the patient gently, prone to because they are prone to bed sores due to the lack of adequate adipose tissue to the cushions in the bony prominences. So, di ba, pag nag-assess ka tayo ng mga risk for pressure ulcers, ang pinaka-area na mas common is yung mga bony prominences. Okay, another one is continue the range of motion exercises gently. Okay, so gently ang paggawa natin dito. Always keep skin dry from diaphoresis, di ba? Habang malapit na kasi yung death ng patient, there is a diaphoresis or yung pinagpapawisan. So, we should always keep the skin dry. Okay? Next one is the nutrition. For the nutrition, administration of IVF, okay? Intravenous fluid as ordered to replace the fluid loss during nausea and vomiting and the diaphoresis to prevent dehydration. Okay? And then, another one, para mapakain natin sila, we will be using the NGT or the nasogastric tube for their feeding. Okay? Kasi hindi na nila kayang, di ba, there is a decrease in muscle tone sa mga patient, hirap silang mag-swallow. So, we should always assist them. So, hindi na ibig sabihin na papatay ng patient, hindi mo na siya papakainin. Okay? So, we should always give them the proper nutrition that they need until the day of their until yung end ng kanilang ano. Kapag may time pa na pwede siyang kumain kasi hindi mo naman alam kung ano exact time ng pagkamatay niya, so papakainin pa rin natin sila. Okay? For the elimination naman, we have the laxative. Okay? Because of yung fecal impaction, di ba? Because of decrease ang kanilang peristaltic movement. So, we will be using a laxative, yung mga pampatae, stool softeners. Okay, next one is the manual removal of impacted stool. Kapag hindi pa rin matanggal, we should do the manual removal or yung magpasok tayo ng yung fingers para makuha yung nag-clog doon na or nanigas na stool. Okay? Irritation may occur due to incontinence, okay, skin care, and application of soothing ointments around the anus and perineum. Okay? For urinary retention naman, we will be using the catheterization, may be necessary and care of the catheter to prevent occurrence of infection. Okay? We should also measure the intake and output kasi once na nagde-decrease na yung hindi na pantay or hindi na siya maganda yung fluid balance niya, okay, there is a deterioration happen. Okay? Positioning and airway. For this one, elevate the head part for easier breathing. Okay, di ba? Lung expansion kapag mas mataas ang degree or yung degree ng head elevation mo. Okay, kapag hindi pa rin kaya, we will be using the oxygen therapy. And also, if patient is unconscious, flat on bed with head turned to the sides to facilitate drainage of mucus from the mouth and throat. Okay, para ma-drain yung mga discharges doon. Okay, suction secretions gently. We will also be using the assistive devices para matanggal yung mga excess saliva, excess sputum, or ano man yung mga excess sa mouth ng patient natin. Okay, next one is the safety. For the safety naman, protect patient from harm. Okay, put put side rails up, okay, para hindi mahulog ang patient natin. Precaution on use of the hot water bag, diba? Lalo pag hindi na nila nararamdaman masyado yung temperature, baka makapag-cause pa tayo ng burn, okay? And then, NGT insertion for tube feeding to prevent aspiration. So, yung source of feeding na nila is the NGT. Huwag na natin pakainin by mouth, baka ma-aspirate pa ang patient. Imbes na sa stomach pupunta yung pagkain, sa lungs pumunta, na-aspirate pa ang patient. Nagkaroon pa siya ng problems sa respiration. And then, sa rest. Okay? So, next one is the emotional needs naman. For the emotional needs, grieving is the normal response to loss. Okay? So, this one, we should show kindness, thoughtfulness, and gentleness. Be sensitive to their needs through sensitive listening, caring, touch, empathy. Okay? And also yung mga soothing presence natin. Presence lang kahit hindi ka magsalita, lalo kapag naiiyak siya, okay, okay, big help na yon. Okay? So, that is a part of emotional support sa patient natin. Okay, love can be expressed through kind, compassionate care for the patient. Kahit hindi mo sabihin nag-aalala ka sa kanya, but through your care, napaka-genuine, napaka-gentle ng pag-care mo, maasikaso ka, mararamdaman at mararamdaman ng patient yan. Okay? Next one is the spiritual needs. For this one, asking the clergy to visit. Okay? The lost leg of earthly journey of the patient should be characterized by peace with God, with other people, and himself. Okay? So, yan yung mga needs ng natin, needs for dying patient. Okay? And then yung mga nursing interventions natin in each needs ng patient. So, next one is the body changes after death. Okay, there is also a changes sa katawan. Okay, after death, mga nakikita, we have yung mga livor mortis. Okay, we have, tandaan nyo lang yung LRA. Tatlo yan, yung mga pagbabago sa patient natin. For this LRA, livor mortis, rigor mortis, and algor mortis. Okay, so yung mga word na yan, may mga indicated din na area or specific na binibigyan ng meaning. For example, when we talk about the livor mortis, this is about the color of the skin. Okay? Color ng skin after the death. Okay, makikita natin to. After namatay, ito yung magbabago. Okay? Una is the livor mortis, which is more on sa color. Okay? Discoloration of the skin after death due to the cessation of blood circulation. Okay? There is a cyanotic skin, di ba? Bluish discoloration of the skin due to the decrease in the blood circulation. Gravitational pooling, okay, and also dependent lividity. RBC hemolysis or the breakdown releasing the hemoglobin which discolors surrounding tissue. Ang pinaka-onset natin sa change ng skin color is 30 minutes. Okay? And ang pinaka-peak na makikita to is within 6 hours. Magbabago na ang kulay ng skin ng dead na patient. Okay? After ng discoloration, andin na yung rigor mortis. Okay? maninigas na siya. Pag sinabi nating rigor, okay, stiffening or maninigas na yung body ng yung bangkay, okay, or yung dead patient. Okay, it is the stiffening of the body due to the chemical changes. Okay, uh, contracted muscles and joint immobility. We have the etiology or the cause here is the lack of ATP or adenosine triphosphate. This ATP, this is an energy carrying molecule found in the cells, in all the living cells. Okay? Ang pinaka-onset nito is 2 to 4 hours, yung paninigas. So, dapat mapalitan mo na yung ano ng patient mo, maayusan mo na siya before pa manigas ang patient kasi mahirap siyang palitan kapag tumigas na yung katawan ng patient na nakakamatay. Okay? So, next one is care following the rigor mortis. Okay? Position body. Okay? Para yung pagka-position mo kung tama, ganun na kasi yun eh. Okay? Kapag hindi mo pa naayos ang katawan, for example, open pa yung arms and hands niya, mahirap na siyang ipagdikitin kasi nga nag-stiff na siya within that time. Okay, so yun yung mga gagawin natin before the rigor mortis bago pa manigas yung mga muscles niya, yung mga joints, okay? So, pagdikitin na proper position ng body. And after that one, place the dentures kung may denture man para hindi lubog din. And then, close eyes and mouth. Okay? So, i-close yan para hindi naman nakanganga tsaka naka-open ng eyes ng patient kapag after na nung stiffening. Okay? Next one is the algor mortis. For this one, ang nag-change is the temperature. So, ang unang una kanina, livor mortis. Pag sinabi nating livor, okay, that is the color or the discoloration. Next, after the discoloration, rigor mortis. Yan yung ating stiffening or paninigas ng katawan. Next is the algor mortis. That is the temperature. Di ba? Manlalamig yan. Di ba? Malamig ang bangkay. So, yun yung ano natin last, algor mortis. Okay, gradual decrease of body temperature after death. Blood circulation stops. So, there will be a hypothalamic function stops also. RBC hemolysis. Pag sinabi natin hemolysis, there is a destruction ng ating red blood cells. The body temperature falls about 1 degree Celsius or 1.8 degrees Fahrenheit until it reaches the room temperature. Okay, the blood circulation stops, decrease skin elasticity, and then the tissue softens. Okay, bacterial fermentation eventually resulting to liquefaction. Okay, so yan yung mga changes after ng death. Okay, body changes after death. Livor mortis, rigor mortis, and then the algor mortis. So next one, we will be proceeding with the postmortem care. Okay, postmortem care. Ito na yung pag-aayos natin sa katawan ng patient after niyang namatay. Okay, lilinisan natin siya, bibihisan natin siya. Okay, tayo po ang gumagawa dyan bago po natin ibaba ang patient sa morgue and then bago siya kunin ng kung uh, ano yung mag-aasikaso sa patient na which is bibihisan siya, okay, asikasuhin din kung saan siya ilalamay. Okay? First one sa ating postmortem care is the positioning of the body. Okay? So, sa positioning ng body, close the eyelids and mouth. Diba? Meron tayong inaano na time for the, yung rigor mortis, yun yung pag-stiffen ng body niya. So, before natin ma-meet yung time na yon, yung onset and then yung duration, yung peak niya, kailangan ng maayos yung katawan ng patient. Okay? So, next one is put back the dentures. Kapag may dentures ang patient, remove all the attachment. For example, meron siyang ilagay na NGT. Okay, hindi naman pwedeng iuwi nila na may NGT ang patient. Hindi naman pwedeng iuwi nila na may swero ang patient. So, i-remove lahat ng mga equipment na naka-attach. For example, yung mga electrodes na nakakonect sa cardiac monitor. Okay, lahat ng mga nakakonect sa patient or nakakabit sa katawan niya, tatanggalin natin. Okay, mga equipments for example, NGT. Okay, or example, naglagay ng catheter. So, tatanggalin lahat yon. Okay, clean the body, butt or lumbar. Okay, so, linisan natin, for example, madugo yung case ng patient mo, linisan naman natin ang patient natin. Okay, para malinis siyang matignan ng family members. And then, Lysol, but for the patient. So, yan yung under ng positioning. Next one is make list of values for endorsement and place in a bag. Pag may mga specific gamit ng patient nung nasa hospital siya, so i-endorse mo sa family member. ilagay mo lahat do'n, ibalik mo sa family member lahat ng equipments ng patient mo or personal belongings ng patient. Okay, next one is make the environment as clean, as pleasant as possible. Okay? And then, make the body appear natural and comfortable. Remove also the equipment and supplies from the bedside. Remove yung mga soiled linens, for example, nabasa or naduguan, okay, naihian, tanggalin lahat yon. Dapat free from odors ang room. And remove place the body in supine position, okay, arms at sides and palms down. Okay? Place one pillow under the head and shoulder to prevent blood from discoloring the face. And then place absorbent pads under the buttocks to take up the feces and urine release because of the relaxation of the sphincter muscle. Para kahit umihi siya or tumae siya, may magka-catch pa rin para malinis pa rin ang beddings ng patient natin. Kasi once na namatayan, there is a no control na sa mga sphincter sa bowel and then sa urinary. Okay? And then, provide clean gown, brush, and comb the hair. Okay, allow the patient to view the patient's body. Kapag naayos na natin ang pasyente, pwede na nating ipakita sa family members. Apply ID tags, one to the ankle and one to the wrist para ma-identify ang patient. Wrap the body in shroud or white linen. Apply another ID tag to the outside of the shroud. Okay, bring the body to the morgue for cooling, okay, which is the cyanosis. So, ito yung mga ginagawa, okay, lalo-lalo na pag nag-work na kayo sa hospital, ito yung post-mortem care sa mga patient na namatay. Ito yung mga kailangan gawin before ibaba ang patient sa morgue. Hindi pwedeng namatay na siya tapos ibaba mo na ganun lang madumi, magulo, hindi pa siya maayos. Okay? So, dapat we should respect the body of the patient kahit patay na yan. Okay? Linisan natin. So, right naman ng mga patient na kahit napatay na sila. Okay, next we should note that while the patient is dying, listen to what they are saying and maintain confidentiality. And also, pray with him and call for the clergy, lalo na pag-request ng mga family. Reassure the family to lessen grieving. Okay? So, next one is the procedural activities that must be completed at the time of the client's death. Okay? Before yan, kailangan na talagang there is a pronouncement of death, the time of death. Okay? Anong araw, anong day siya namatay. Ilalagay yan sa chart ng patient and then sa death certificate ng patient. Okay, another one is the death certificate. It documents the time and cause of death. Okay? Yung cause of death naman, ang sasabi dyan is yung attending physician. Okay? Request for postmortem examination, autopsy, with the written consent from the next of the kin if required by law. Okay? Next is request for organ or tissue donation if the client is medically judged to be suitable donor. Okay? And then also, deterioration of the funeral home, the family selects the mortician to embalm or i-cremate ang patient. Okay, so yun yung mga activities na gagawin after na nung postmortem. Okay? And then, we have also the bills of right of the dying patient. For this one, they have also right, di ba? Hindi lang ang patient yung mga alive na patient ang may right. So, we have also rights for the dying patient. Okay, I have the right to be treated as a living human being until I die. Okay, to maintain a sense of helpfulness. Another one, to be cared for by those who can maintain a sense of hopelessness. Okay, to express my feelings and emotions and my approaching death in my own way. To participate in decisions concerning my care. To expect continued medical and nursing attention even though cure goals must be changed to comfort goals. Not to die alone, okay? May mga rights sila yan. To be free from pain, where they are giving placebo, okay? Para at least alam pa rin ng patient na the doctor is giving the right treatment for him or her, lalo na kapag request niya. To have my question answered honestly, not to be deceived, okay? Wag silang lokohin. To have help from and for my family in accepting my death. So we should also, aside from the patient, we should also assist the significant others through the grieving, okay, after the death of the patient. Okay? And also, to die in a peace and dignity, to retain my individuality and not to be judged by my decisions, which may be contrary to the beliefs of others. They have also the right to discuss and enlarge my religious and spiritual experience regardless of what they mean to others, to expect that the sanctity of the human body will be respected after the death, and to be cared for by caring, sensitive, knowledgeable people who attempt to understand my needs and will able to gain more some satisfaction in helping me face my death. So, yun yung mga rights ng dying patient. Okay? Next is the death-related religious and cultural practices. Okay, various cultural and religious traditions and practices associated with dying and grieving, associated with death. A dying and grieving process help an individual cope with those experiences. Okay, nurses are often present through the dying process and at the moment of death, so knowledge of the client's religious and cultural heritage help nurses provide individualized care to the clients and their families. Okay, many cultures prefers to a peaceful death at home rather than in a hospital. So if that is the request of the patient, then iga-grant dapat. Kasi nga may right ang patient, di ba? Ang dying patient natin. Okay, members of some ethnic groups may request the health professionals do not reveal the prognosis of the dying client because they believe that the person's last day should be free from worry. Other cultures prefer that a family member, preferably male, to be told the diagnosis so that the client will be tactfully informed by the designated family members in gradually or not at all. Nurses all need to determine whom to call and when as the impending death draws near. Okay? So yung mga practices, religious and cultural practices. And we have also the belief and attitudes. For this one, okay, autopsy may be prohibited or opposed, discouraged by Eastern Orthodox Muslims, Jehovah Witness, and Orthodox Jews. And organ donation is prohibited by the Jehovah's Witness and Muslims. Cremation also, may mga belief din dyan. Okay? Cremation is discouraged and then opposed by Mormons, Eastern Orthodox, Islamic, and the Jewish faiths. Hindus also prefer cremation and cast ashes in the holy water. Kapag Christians naman, they use medical means to prolong life and the Jewish faith generally opposes prolonging life after irreversible brain damage. Buddhist naman, permit euthanasia. Okay, yun yung mercy killing. Okay? Sa Buddhist yun. Nurses, not to be knowledgeable about the client's death-related rituals such as last rite, chanting at bedsides, and the like. Okay? So, for our notes here, okay, nurses play a significant role in death and dying process. Nurses who work with the terminally ill and with bereaved person develop a heightened empathy and identification with their patients. They take emotional grief and form bonds to demand the grief response. Okay. However, nurses are susceptible to all the emotional of grief, frustration, sadness, guilt, anxiety, depression, helplessness, anger. Therefore, it is necessary for nurses to have emotional stability in these situations. Okay, so iniwasan natin dito yung sa attachment kasi nga once na namatay ang patient mo, okay, baka sasabihin mo sa sarili, may kulang pa ba na ginawa ko? Okay, kahit ginawa mo naman na. To be an effective caregiver during this time, a nurse must learn to recognize the patient needs and not his or her own attempt to meet them. Okay, allow and encourage the patient to talk and express his or her emotions freely in a non-judgmental environment. Be available to the patient's respect, okay, patient's behavior, and listen to the patient while he speaks. And the nurse must not also forget his or her role to the family members and loved ones of the patient. So that's all for our chapter 11.